Hi and welcome to Healthy Living. We are here today to introduce our physicians with Kelly Presnell, Director of Marketing at Hilton Head Hospital. Thank you for joining us. It's always fun to talk with you. We have a great doc to talk to today.
Yes, Dr. Nicholas Mihalec. He's one of our orthopedic surgeons who's on the medical staff here at Hilton Head Hospital. We also have Dr. Joe Tobin and Robert Gavin, orthopedic surgeons as well. Dr. Mihalec today is going to talk about knee replacements and the newest technologies that we're offering to treat people that need a knee replacement.
We're excited to talk with him. When he walked in today, it was kind of fun because he got all kinds of things to show us, models, new cutting-edge, innovative techniques. It's exciting.
The physicians like the toys,
yes,
the implants, and they like to show the tools, things that they're using on a regular basis, to do their operations.
Well, we're going to take a quick break and come back and talk with Dr. Nick Mihalec. Thank you.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
Hi and welcome to Healthy Living. I am here today with my friend Dr. Nick Mihalec. I'm very excited to talk with you today. We're going to be talking about, I think, something that's very interesting to a lot of people, really at any age. And it's been a ball talking to you before we even get started taping about knee replacements. And all the innovations that have occurred, just the changes in knee replacements, it's absolutely fascinating. And Dr. Mihalec today is going to take the opportunity to allow us sort of to see inside what goes on during a knee replacement. Thank you for joining us.
You're welcome.
Talk to me a little bit, if you will, before we get started about the prevalence of knee replacements. Are there different kinds of knee replacements, and what causes that?
There are a whole knee replacement where all the surfaces of the knee, the kneecap, the end of the femur, the tibia bone, gets resurfaced with metal and plastic, and then there's half knee replacements where you're only worn out one side and you only need to get half of it replaced.
Is it just good old age that helps our knees deteriorate, or do things exacerbate it?
Mostly. Some people try to relate trauma to it, but I see many people in their 50s and 60s with old football injuries that don't have a lick of problems, and I have other people that were couch potatoes that are are worn out. There doesn't make any sense. I personally think it's probably related to your ancestors.
Oh, a lot of genetic
predisposition.
Let me ask you a question about when to come in, when to see you, an orthopedic surgeon. Is it because of chronic pain? When do I come in?
Chronic pain, stiffness, hard to get up and down stairs, keeps you up at night.
Okay.
Those kind of things that we can actually address. And there's varying degrees of what we can do. Some people will even have an isolated episode where the knee will swell up and it's just an inflammatory process, and we can take the fluid off and put some medication in and it goes away. Other times we see people that are going through a cascade of losing the cartilage in their knee, and no matter what we do, it doesn't help. And most people fall somewhere in the middle.
In between.
Yeah.
Are there, when you get a pain in the knee, are you going to feel it in a specific area, or there are different areas you can feel it in?
Well, if you have an injury or you wear out the inside, you'll feel it on the inside, and the same with the outside.
Okay.
Most people kind of feel, with arthritic changes, they feel an ache, and this ache comes and goes. There is something to the old wives' tale about the weather changes. My rheumatism tells me it's going to rain. It turns out that some crazy person did a study where they put pressure transducers inside people's bones and measured the atmospheric pressure. And in arthritic joints, they ached whenever we're going to get a storm.
Oh, it's so
interesting. It's the
interesting.
pressure difference that does it, and that's why people can predict that it's going to rain.
When I come into you with aches and pains in my knee, how do you make that assessment? Are there a series of or battery of tests that you go through?
Sure. Mostly, if I'm not concerned about this being a inflammatory arthritis or what we call autoimmune, like rheumatoid, that requires some laboratory testing. The best test is an X-ray, and for knees, a stand-up X-ray, because with your weight on it, if there's no joint, then it shows up. Sometimes, if you lay down and get an X-ray, it shows that you still have a joint left when you really don't.
Oh, interesting. Now, all right, let's talk. We've got all kinds of things to show you today, so bear with us. It's going to be pretty interesting. Show me what I am holding now, if you will.
This, we get to the point where you need a knee replacement.
Okay.
And ordinarily, we go ahead and make an incision and expose the ends of the bones. And then we have to make decisions on how to make the cuts to shape the bone to take the prosthesis, but also alignment is absolutely critical, because we don't want you too loose on one side or the other. That'll lead to failure. We don't want you too tight so that you can't bend it. And all these things are up to the surgeon's skill and training. And it usually involves a rod that goes into the marrow cavity of the femur and down into the tibia.
So it's a fairly big operation.
It's a big operation. What we are doing, what we have available at Hilton Head now is high-tech procedures to eliminate some of the surgical steps, plus give us the perfect knee every time.
You're excited about this. This is good.
What we have here, this is plastic.
Okay.
This is a computer-generated model of a patient that had a surgery recently. This is actually, he underwent a MRI scan of the entire leg from the ankle to the hip, and that's how we get what angles to put in. I don't know if the camera can show. It shows where the line shows where the cut should be, and it's critical to how you align that for the overall alignment of the leg, and it's critical for longevity.
Is this an actual patient model that is from the MRI?
Yes.
Okay.
This is a model of his. This is done by the processor who makes a model of his bone, and then I get to look at it on my computer and decide the optimal size. They initially pick a size, and this particular fella, they picked size 68, which meant 68 millimeters, and I decided that a size 70 would better fit him, and so I can fine-tune it.
Really customize it to each patient.
It's absolutely customized, and without having to make the alignment myself, we can save about 20 minutes of surgical time.
It is really unfathomable to me. I mean, it's amazing how specific.
How this works is the other part that they send us is a little pinning jig that we put on here, and what we
it's like a template, really.
It's a template, and what we do on the patient's knee, we transfer this from the model to the patient's knee, which fits exactly. It has the same bony contours and bumps. And then what we have is we can put pins through here which will set our cutting jig just right.
Perfectly.
The perfect angles. And the same with the other side of the knee.
Here, I'll get to be. This is my favorite thing to do. It's so fascinating. I mean, it really is. And again, we're talking about knees and knee replacements and all the cutting edge things. Okay.
And this is how it looks on the tibia. And we put the pins here, and
Here, I'll get it. Yeah,
and we can see where the I don't know if the camera can pick it up, but there's a line across here where the what we call the osteotomy or the cut should be. And
what is the average length of time for an operation like this?
it's about an hour and a half,
Wow.
but we can actually cut it down 20 minutes by using this computer-generated pinning jig.
So it really takes the calculations that you make on site. It sort of helps. You can do that ahead of time. It makes you more proactive, whatever the.
Absolutely, and with having the computer three-dimensional model that I can turn 360 degrees, I can look and say that if they had a size 83, it might be too big, that it would overhang in certain places. I can actually punch a button on the computer program to take it down to a size 79.
Oh my gosh!
And so I can play with everything, and once I've got it set exactly what looks the best fit, then I authenticate, and then they begin the manufacturing process for this.
Oh my gosh! Now, once it is set into place, and that is when recovery begins.
Yes.
And what is typical protocol for recovery from a surgery like this using this?
It's not a whole lot different than others, but you're in the hospital about 3 or 4 days.
Okay.
And some people have a great experience and are out a little bit sooner, but that's about the average. And the goals to go home and what therapy is done for is for you to be able to take care of yourself.
Okay, so it's activities of daily living that really we're looking for.
Be able to get up and down without anybody lifting you, to
Toilet
toilet yourself,
Yeah.
take a shower, and all that kind of stuff.
I'll tell you what, it's so fascinating. We're going to take a quick break. Once again, we're talking with Dr. Nick Mihalec. We're talking about knees. We're going to come back and look at a whole other set and way of doing knee replacements. Stay with us. We'll be right back here on Healthy Living.
Excuse me. Hi, can I get through, please?
Dr. Newman.
You know, there has to be a better way. A way to skip the ER waiting room. Like this lady over here. All she did was log on to inquicker.com to hold her son's place in line. Now they can wait at home and skip the ER waiting room. Now, which would you choose? This or this? Hold your place online at inquicker.com and skip the ER waiting room. Ooh, is that hot cocoa? Oh, help yourself.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here to Hilton Head Hospital.
We are back here on Healthy Living. We are here today with Dr. Nick Mihalec. We're talking about lots of things about knees and knee replacements. During the break, we had a couple of questions that actually came up, and the first one was, What are the materials that are used for a knee replacement?
Nearly all the materials that are used on the end of the femur, the hardware is cobalt chrome stainless steel alloy. It's a very hard metal, and it's used because it doesn't wear very much. Titanium was tried, but titanium alloys will wear right through. And on the tibia, we do put titanium because it holds a plastic insert. We can kind of see this model here, which we'll get into in a little bit, but there's a cobalt chrome steel on top of a high molecular weight polyethylene, which is held in place by a titanium plate, and the titanium moves with the bone. Titanium alloy has nearly the same material property as bone, and it gives a little bit.
And what are the advantages of those two materials?
The femur material, it's hard and it won't wear out.
Okay.
And the material property of titanium alloy is that it matches the give and flex of the bone.
And you shared something about the actual pain reduction. Pain reduction is caused?
What the interposition of the metal and plastic does, it puts an unfeeling object between the bones. The bone then only feels the prosthesis, and you don't feel bone grinding on bone, and the interposition of the plastic and metal is what really gets rid of the pain.
So the pain initially is just from bone hitting bone and just...
before you do surgery, and that's why it just doesn't go away. And that's why activities will really aggravate it.
Talk to me a little bit about this set that you have here and some of the interesting
This is an interesting concept which we now have available here too. Some people, especially if you're in the sub-65 age group, only have one half of the knee worn out. And we know that all these prostheses have a limited lifetime.
Okay.
If you're 50, even if we had a 20-year, 25-year lifetime, by the time you're in your 70s or mid-70s, you're looking at another big operation. And we know that even a half-knee replacement lasts a little bit less, but the advantage is you take less bone. Each time you have a knee replacement, you lose a little more bone, and there comes a time, maybe the second or third surgery before you pass, that you might not have enough bone to do it.
Oh.
And so we're looking for ways to spare bone. So in the younger age group,
I never even thought of that.
We think about the half knee replacement, and this particular technology takes even less bone than the many of the other manufacturers. This is made by Conformis, and again, we have a computer high-tech scan-derived manufacturing process. This does not just create the milieu for putting in a bunch of standard prostheses. This is the only one that's actually made to mimic the patient's own end of their bones.
So it literally is customized. It's custom made for you, for your knee, for whatever is ailing, if you will.
Right. And again, we get a, this is what it actually can kind of look like on the computer.
Like a bone spur.
And what we have here is an initial picture, and the orange and the green are bone spurs. When you have an arthritic joint, Mother Nature seems to try to widen the joint to spread the load. And the Conformis people do this because we need to remove these things before we can begin our process. And once we've done that, we have to make a note of where the prosthesis is going to sit and make a line here, and we recess it in any cartilage that's left. So the first step would be to remove the cartilage that's left on the end of the bones and take out the meniscus so that we have bare bone, because what we have then is we're going to replace and rebuild in certain cases whenever the bone's worn out back to the normal contours of the knee.
So you actually have to rebuild it back sometimes.
Right. Sometimes things are worn down that we have to add material
Interesting.
to it. And when what we have then is a contoured prosthesis that is done for that specific patient. It only comes in one size, and it comes just to resurface the knee. And you can see that there's this little curve to it there.
Right. Looks like a C almost.
Most of the time, the standard knee replacement will be kind of oval, and there'll be some sticking out here or overhang there. But this is done perfectly for the patient. And
why is that an advantage? Just less rubbing or less air?
Because it's your natural knee. Because it really allows it to move like your knee would before it wore out.
Okay, makes sense.
And the other side of it, the plastic side, is dished out like your normal tibia would be dished out.
Okay, so concave.
So that this is convex and this is concave, but it's done by the computer to exactly match. And so this is available, and this is truly a minimally invasive surgery. We don't need a very big incision to do this. And there are many places that are doing these now where it's an overnight stay after you have your surgery.
Is it really? Now, what kind of a recovery again for this, or what kind of pain do you feel afterwards? Is it just a matter of stiffness?
Well, it's stiffness, and anytime you take a power saw to the bone, it's going to hurt for a period of time. But
makes sense.
But most people are saying that two things happen. It's a little less because you're only working on half the knee.
Okay.
The other parts of the knee, the outside and the kneecap, are your own. So it feels normal. So this feels a little bit more normal, and the advantage in a younger person, if you only have a half a knee worn out, is that you haven't burned very many bridges. You don't really remove very much bone from the edge of the femur. The cartilage is scraped off, and this is onlaid.
Which you basically said is an issue. You want to minimize.
Right.
Okay.
Right. And so this is bone preserving, and then when and if this wears out, you haven't burned any bridges because your resection here is not any lower. In fact, it's a little higher than you would for a regular knee replacement. So that your option after this wears out is to be able to convert it to a regular knee replacement, and it's like you did it the first time.
Let me ask you a question when it comes to rehab or use of that knee after surgery. Is the goal for a knee replacement to go back to normal activities of daily living? Should I be able to walk on my treadmill again?
You should be able to do all kind of treadmill activities, and as orthopedic surgeons, we used to warn against marathoning and tennis and anything where you're impact loading and sliding. And most of my patients who want to be active on the island ignore me. and much to my delight, I have not run into any specific issues with the knee wearing prematurely because of somebody being active.
There are some other pretty interesting places. I know we had looked at a jig before. Can we see a couple of those? We've only got about a minute left, but just for the sake of show and tell.
Okay, this is for sake of show and tell how this would be accomplished. We have several different sizes of these spacers that we put in, and we start with resecting the tibia, and this is our resection guide. So once we've got on there, we know this guides us how to make the vertical cut and the horizontal cut, and then the other guide that we started out with, which we showed you before, this goes on the knee to show where the prosthesis is going to
and Dr. Mihalec,
lie.
You said something really interesting, and then I know we have to go, but when I ask you if things change in this field exponentially, you had a really nice, you said...
I think everything at this point in time is evolutionary. It's not revolutionary. We see refinements in what we do. The basic knee prosthesis design has been just slightly modified by various manufacturers and investigators from the mid-'80s. And so it's stayed tried and true, and it's the same with hip replacements. Dr. Charnley in England developed a hip replacement in the 1960s and early 70s, and the same basic design. What we've gone through is some growing pains with what we call bearing couples. I think everybody's aware of all of the advertising about metal bearing couples.
Yeah, we've heard it. Well, it is always wonderfully informative to have you. We thank you for your time. We thank you for your viewing, and we will see you all later here on Healthy Living. Have a great day.